Hi, I'm Andrea Arce, a medical student, and in this video, I will be demonstrating 3 tuning fork tests, namely Weber, Rene, and Schwabach tests. Tuning fork tests are useful in assessing hearing loss. It may be conductive or sensory neural hearing loss. Tuning forks can be activated in 2 ways. Unfortunately, I don't have a real tuning fork at the moment, so I'll be using this improvised one instead, assuming that this is the base and these are the thighs of the tuning fork. So first, it can be done by flicking it between your fingers. You should hear the sound. Or by tapping the tuning fork gently on the knee or elbow. And before starting any procedure, it is important to explain the test clearly to the patient. Let's first do the Weber's test. Explain to your patient that he needs to tell you in which ear does he hear the sound loudest. Left, right, or in the middle. So can you tell me whether you hear the sound loudest in your left ear or your right ear, or whether you can hear it in the middle? If the patient can hear it equally on both sides, he has a normal hearing. While if it is louder in one side, it may be a conductive or sensory neural hearing loss. Next is the Rene's test. This is used to compare air conduction and bone conduction. On this test, explain to the patient that he's gonna hear a buzzing sound and he should tell you in which position it is louder in. First position. This tests air conduction. This is done by placing the vibrating tuning fork vertically in line with the external auditory meatus in about 1 to 2 centimeters away from the opening. Normally, air conduction is louder and heard twice as long as bone conduction. So in normal persons and persons with sensory neural hearing loss, air conduction is louder than bone conduction, which is termed as Rene's positive test. While in persons with conductive hearing loss, bone conduction is louder than air conduction and is termed as Rene's negative test. So this is the second position. This position tests the bone conduction. This is done by firmly placing the base of vibrating tuning fork on the mastoid bone or any bony area surrounding the ear. And lastly, the Schwabach's test. Now on this test, ask the patient to raise his finger or say stop as soon as he stops hearing. I'll be putting the tuning fork on you and please raise a finger or say stop if you stop hearing the sound. This is done by placing the base of vibrating tuning fork over the mastoid process of the patient. Basically, this is a test for bone conduction. Now when the patient stops hearing, I'll immediately put this still vibrating tuning fork on my mastoid bone. This is almost similar to absolute bone conduction test but is done without occluding the canal. Mainly, the patient's bone conduction is compared with that of the examiner's. Hence, the examiner's hearing should be normal before doing this exam. If the patient hears it equally with that of the examiner, it is normal. If the patient hears for a longer duration, it is a conductive hearing loss. And if the patient hears for a shorter duration, or if the examiner hears for a longer duration, it is a sensory neural hearing loss. And that's it for our tuning fork tests demo. I hope you guys learn and enjoy. Thanks for watching!